Since statins are touted as wonder drugs for heart health, you'd think they would help people with heart failure. But do they? Let's look into that. Stay tuned. So before we can actually answer this question, I have to clarify some terminology because I was very confused about this when I first started on this journey. And I just want to make sure we all understand the difference between a heart attack and heart failure. Now, this is going to be more high school biology level. This is not medical school level descriptions. A heart attack is an event. It occurs when adequate blood flow does not get to the heart tissue. We've got to realize that the heart is a pump that pumps blood throughout the body. And one of the destinations for that blood is the heart muscle itself. It needs blood to function just like every other organ, just like all the other muscles in the body. Another way to think of this might be as an analogy to a car. If you're driving your car and you get into an accident, that's an event. No reflection on the health of the car before that. It's just something that happened. The car may be totaled, kind of like dying of a heart attack, or the car may be repairable. In other words, a survivable heart attack. Heart failure, on the other hand, is a condition. Heart failure can be divided into two types. There's left-sided heart failure and right-sided heart failure. We're only going to be looking at left-sided heart failure. The most common is the left-sided heart failure, and that can be further broken into two types. Systolic failure, and that happens when the left ventricle, shown here on the diagram, can't pump efficiently to move blood out of the heart and into circulation. Just can't get the output. Diastolic failure is when the ventricle becomes stiff and it can't relax, so it can't get enough input. Can't put as much output just because it doesn't have as much in, so it can't bring the blood in. So that's the difference between these two types of heart failure. It is a condition, kind of like driving your car and the check engine light comes on. The car's still functional, but you better look into it to make sure that the car is going to stay healthy, so to speak. We're going to look at several papers, and a lot of these are small studies or descriptions of small groups, so we have to bear that in mind as we go through this. So we're going to go back in time. These are all going to be in order so that we can see the development of this thought process. This paper here from 2007, Statin Therapy in Patients with Diastolic Heart Failure. They say in it, there's still a lot of controversy about the possible use of statins in heart failure patients. It's been established that low levels of total and LDL cholesterol are associated with higher mortality in this population. Key word there is associated. An association is not necessarily saying there's a cause and effect, as the LDL being higher caused the longevity, or is the longevity somehow caused a higher LDL? That part's not known, at least for the purposes of this paper. The next paper, we're going to move ahead a couple years. Heart failure may worsen with statins. They make this statement. Overall, the patients taking statins had worse lung function and exercise tolerance than those who weren't taking the drugs. One of the impacts of heart failure is lower exercise tolerance. As you can imagine, if the blood can't get into the system and can't get to the muscles, you're not going to tolerate exercise as well. But when these researchers analyzed the patients with the two different types of heart failure, systolic and diastolic, separately, they found that the drugs actually seemed to help those with systolic heart failure and it hurt those with diastolic. That implies that it hurt people with diastolic heart failure more than it helped people with systolic heart failure. Moving on to 2017, there was an article, No Benefits of Statins for Sudden Cardiac Death Prevention in Patients with Heart Failure. In it, they say statins do not reduce sudden cardiac death, all-cause mortality, but may slightly decrease hospitalization for worsening heart failure in heart failure patients. This statement only applies to people with heart failure. If you have heart failure, statins aren't going to help prevent cardiac death, aren't going to improve all-cause mortality. The point is that statins don't act like a wonder drug in people with heart failure. They go on to say, until new evidence is available, this study supports the 2013 guidelines. Remember when this was written 2017, so the 2018 guidelines hadn't come out yet, to not systematically prescribe statins in people who only have heart failure. That shouldn't be a criteria to giving statins, because that should avoid unnecessary polypharmacy. Polypharmacy, more than one drug being given to a person. In this case, the implication is to treat the adverse effects from the statins. So moving on ahead, a paper entitled Statin-Associated Cardiomyopathy Response to Statin Withdrawal and Administration of Coenzyme Q10. Now, in this paper, they're postulating this condition known as statin-associated cardiomyopathy. So here's the three conclusions that they had in this paper. Now, this is a very small group, and we're going to get to that in a moment. First, some patients who are receiving long-term statin therapy experience heart failure along with other statin-attributable adverse effects, most of whom respond positively to withdrawal of statin and the addition of CoQ10. Now, I've talked about CoQ10 in other places. It is a critical coenzyme in our bodies, and the chemical pathways that statins interfere with also will reduce CoQ10 probably to the same proportion that it'll reduce cholesterol in a person. This was based on a study of 142 patients, and they all had heart failure, and it was surmised that the heart failure was from statins. And these patients presented with these statin-associated adverse effects. 93% of them had fatigue. 73% of them had memory loss. There was muscle weakness. There was muscle pain. There was peripheral neuropathy. Interestingly, I had all 5 of these. Was I headed towards heart failure when I was on statins? It's possible. While all the people with heart failure had these other symptoms, that's not the same thing as saying everybody with these symptoms is also going to have the heart failure. It doesn't work that way. You can't go in the opposite direction. It is interesting to note that out of all these patients, they all had these other adverse effects along with their heart failure. This SACM, which is statin-associated cardiomyopathy, let's break into those words a little bit. Cardio, heart, myopathy, muscle damage. So statin-associated cardiomyopathy is statin-associated heart muscle damage. And they're suggesting that it may be a factor in the current increasing incidence of heart failure. So while heart attacks may be down, the implication here is that heart failure is up in whatever population they were looking at. The key one to me is that these observations may alert practicing physicians and patients that this condition actually can occur, so they're in a better position to recognize what is otherwise, key phrase right here, gradual and insidious process. And that's what it is. If you were taking statins and after 5 years you had heart failure, what's your doctor likely to say? Wow, you probably would have had heart failure 2 years ago if you weren't on the statins. Or, oh, that's too bad, you're just one of the few people for whom statins didn't prevent this from happening. They probably wouldn't stop to think that maybe the statins caused it. And that's the key finding in this paper, is that it appears that the statins caused the heart failure. We always got to keep that in mind. Finally, a much more recent study, statins lower cholesterol but not necessarily heart attack risk. I'm not going to get into the main point of that particular headline, but there's a point in here that I do want to point out. And here's what they had in this paper. In some trials, reductions in LDL were associated with significant reductions in risk of dying, but in others, reductions did not reduce this risk. Okay, so that's just basically saying that jury is still out and that the evidence isn't clear. This is an important finding because clinical guidelines have expanded the proportion of people eligible. There's an eligible word again there, like you've won a lottery, you're eligible for statins, because they keep on lowering what they consider the ideal LDL cholesterol levels. This first paragraph is suggesting that's maybe not a good idea. The point I want to make here is, like they said at the end, for example, one study estimated a 600% increase in eligibility, there it is again, for statins between 1987 and 2016. Well, a 600% increase eligibility probably followed by some similar increase in the number of people who actually will take statins. They're all being subjected to this possibility that it's going to lead to heart failure. But what I couldn't get out of these studies, and they were all small studies, is, well, what is the percentage of people who actually do experience heart failure from taking statins? And that part's not clear to me. Going through these papers, I really couldn't tell that, just that it is a possibility and it's been increasing in the population. So what's the point of all this? Even if we are in a situation where we think that statins can be helpful, we need to know some important and subtle details about our condition. For example, are we headed to heart failure? Do we already have heart failure? If we do, is it left-sided or right-sided? If we have left-sided, is it systolic or diastolic? If it's diastolic, stay away from the statins. At least that's what these papers are telling me. Another point is a class of drugs, these statins that are supposed to protect us from heart disease, may be causing heart failure in some patients. Keyword there is some. I don't know how many. I think more study is needed to find out how many. Another important point that comes out of this is the idea of tolerating statin-related adverse effects is a bad idea. Because what happens when you go to your doctor and say, Doc, I'm having these adverse effects, I'm fatigued, I'm having muscle pain. They say, why don't you hang on for a while? Your body may adjust and you'll get used to it. Or maybe you need to adjust your lifestyle because after all, you need to keep your heart healthy in order to live a longer life. You're going to live a less fulfilling life, I guess is the idea there. But that may be counterproductive because these adverse effects may be a red flag warning you that the statins are giving you heart failure. Ultimately, when it comes to statins, it's buyer beware. So that's what I've got on this subject of statins causing heart failure. I wish I could give statistics on how common it is, but just the fact that it's an idea that's out there is important. So if you appreciate this content, please like, share, subscribe, and comment on this topic or others that you'd like me to cover. And if you haven't seen this video, I recommend you take a look at it now. Thanks for listening.